Under the Republicans' replacement plan, older Americans will be forced to pay premiums up to 5 times higher than what others pay for coverage. And I'm not talking about a few $100s. This bill would hike premiums for older Americans by $8, $10, even $12,000 every year. Now, Republicans like to say their plan will give Americans more choice over their health care. But if you can't afford any of the choices, that's not choice. What good is that? Some of my constituents told me that for them, this is literally a matter of life and death.
I live with cancer. I live with HIV. I live with epilepsy. I live with tinnitus, which causes ringing in my ears, and my left ear is deaf. I also live with severe depression and bipolar disorder, too. The ACA has literally saved my life. I'm proud to call it Obamacare. It's saved my life. It allows me to go to the pharmacy. It allows me to see my doctors. My doctors are fantastic. They call me up to see me for checkups. They come to me. I don't have to go to them. That is the Affordable Care Act and what it does. Before the Affordable Care Act, I was on charity care before I was paying for my own insurance. I didn't have this wonderful health care then. Up here, we're not numbers. We're not percentages. We are faces, we are people. And our lives, if we should not be here, that affects our family, that affects our friends, and it affects the people who rely on us for what we can give to them. Without the Affordable Care Act, without Obamacare, we cannot fulfill our obligations to others because we're not healthy. I don't understand why Republicans want to take away health care from people. I don't understand Republicans in Congress and Republicans in the Senate who have health insurance that is given to them, that they want to take away my health insurance and the health insurance of the people you see here with me. It's despicable.
The expansion of Medicaid was a critical element to so many. Most of these Americans are hardworking people whose jobs just don't come with health benefits. Beginning in 2020, that's 2.5 short years from now, the GOP bill effectively ends Medicaid expansion. But the damage doesn't end there. 1 out of every $2 spent by Medicaid goes to long-term care. And this terrible legislation robs states of $880 billion in Medicaid funding over the next decade. That means turning elderly patients away from nursing homes, reducing services to Americans with serious disabilities, and punishing the most vulnerable in our society. This bill doesn't give states more flexibility or more choice. If I say to you, I'm going to give you more choice, but I'm going to take away, half of your money, well, that's not really more choice at the end of the day. So the suggestion that more choice is going to take place by dramatic cuts and a cost shift to the states of that size of money is truly an alternative fact, which my late mother used to call something else.
A little over 4 years ago, I had lost my job, thus leaving myself and my son without medical insurance. One night, he got really sick. He has asthma, and as it develops, it also leads to croup. And I gave him the treatments that I had at home. We had the nebulizer, and I took him outside, and I did everything that I was supposed to do. However, nothing was working. I did hesitate to take him to the hospital because we had no insurance, and I didn't know how I was going to pay for it all. And eventually it got to the point that I had to take him. And when I did, the doctor told me that if I had waited just 5 more minutes, my son Zachary would not have made it. He was able to get insurance through the Medicaid expansion. He was able to get the treatments that he needed. He was able to see a pulmonologist, which I didn't even know existed. And without this expansion, I don't know where he would be. He's 7 years old, and he's been sick since he was 2. And the expansion, it meant a lot. It meant that he was able to get the treatment that he needed. It meant that he was able to get the medication that he needed. And for me, it meant that my son is here today. So I don't know where we would be without it.
This bill leaves governors and legislators with no choice but to reduce services to everyone who relies on Medicaid, from pregnant women in need of prenatal services to disabled Americans in need of round-the-clock care. And we don't even have the time to talk about the economic implications of the devastating cuts today. But let's be clear. When you take $880 billion out of state healthcare systems, everyone feels the pain.
To Speaker Ryan, I would like to say this. The Affordable Health Care Act has not been a nightmare for me. It's been a godsend. Just as you and your fellow congressmen are eligible for, no, let me say this correctly, you're entitled to government subsidy for your health care. The ACA has done that for me, and so it's made health care affordable for me. So although average premiums are predicted to go down in the next 3 years, your plan will not make health care more affordable for all Americans, because I'm not an average. I'm a person, and you're dealing with people's lives.
When you add 24 million people to the ranks of the uninsured, everyone feels the pain. When you send more people to emergency rooms as their primary health care vehicle, when you saddle consumers with higher out-of-pocket costs, when you end protections against insurance companies' abuses for patients, everyone feels the pain. And for what? To cut taxes by over $800 billion for health insurance executives and the Donald Trumps in our society? Certainly not on my watch. This legislation is cruel, it is misguided, and it must be defeated.